We've talked a lot about the positive impacts that Heidi and AI scribes can have within the healthcare industry.
Yep.
What are some of the negative impacts that could occur?
Probably the big one, I think, is just about the change in workflow. So like I've seen some people wonder if maybe having a scribe reduces your retention of data. So that process of writing and doing synthesis can make it more sticky in your mind, which is valid, but the trade-off, I think, is lots of clinicians never actually write their notes until the end of the day.
Yep.
So what they are recalling isn't accurate.
Yep.
So there are other ways to combat that. You know, people can still write their notes as they go in the context tab. Like you have to just intelligently design the tools, I think.
Yeah.
But that is a possible negative, I think.
And do you think, one that I've also heard in speaking to people is that they think this will replace certain people's jobs within the healthcare industry, whether that's medical administrators, receptionists. Do you think that is something that could be down the track?
With technology, I have a positive sum view generally. So like if you look at most public health systems around the world, the cost to serve them is going up a lot. There's less and less human workforce that really want to do a lot of the work. For example, like there's general practice shortfalls, and it's for a number of reasons. Like there's a lot more diagnosis of chronic conditions than maybe even 20 or 30 years ago. So there's just a lot more care that needs to be given with a similar kind of workforce. Rather than role replacement, it's more likely that there'll be modification of some roles. Like sure, perhaps Heidi does a better job of drafting a referral letter or updating a care plan. So maybe that practice nurse is no longer doing that administrative part of their role, but that should free them to do lots of other things, like maybe go home, visit the sickest patients that clinician manages, or maybe reception can focus on proactive engagement of patients that need certain care or are due for repeat appointments. Beyond just Heidi, that's how I view the world. Like when there's new technology, sure, there will be some trepidation about how's this going to change things, but it should just liberate the same number of people to be able to do more healthcare if that's what they want to do.
So it's about evolving those roles and taking them to the future instead of people losing their jobs or anything like that.
Exactly, yeah. I think like probably within that there's like an embedded fear about psychologists worry that maybe like AI is going to replace that entire role of the clinician. I think that's very far off and quite unlikely.
You do hear some companies out there saying, oh, well, here is my digital psychologist or whatnot. And so when clinicians see things like that, they do start getting worried that you're slowly taking away parts of what I do. Is the end goal to completely remove me from the ecosystem? How can you answer that just from a Heidi perspective, I'd say?
Yeah, I think from our perspective, it's almost the opposite. Like we're subservient to our clinicians. So everything we build is things that they're asking for or want us to offer. And I think it's like a deep question about like how do humans want care delivered to them? Do they prefer to listen to someone who has the human experience, has lived a life, can empathize with their experience? A machine maybe one day is better than us at spitting out the diagnosis and the guideline that applies here. I can see a credible path to that, but I don't really see a world where patients aren't sharing their stories and what's happened in their lives. Like that's the safest form of medicine that I've experienced, is where you have real longitudinal relationships with your patients. And even in those cases, like humans already augment their care. They look at guidelines, they enrich like their plans with evidence that comes from more objective sources. So that's kind of where I see Heidi going. Like, sure, maybe we help reference the right guidelines or pull in the latest research, but still the human is the conductor of
so keeping that human in the loop at all times, basically.
Exactly.
You've touched on what you see potentially in the future. How do you see the role of clinicians who do use AI compared to ones who choose not to use it?
First and foremost, they'll just be way more productive, so they'll have plenty more time. I think that would mean they have the ability to do better care. Assuming Heidi is finding guidelines for them, saving them lots of time, doing downstream tasks, it's pretty clear to me that that clinician with AI is going to be much better at practice than the clinician without AI over time. I can even see a world where clinicians almost like mandated to use some sort of safety net, like a pilot who is full manual now. Would you get on that plane? You
probably not. No.
Yeah, exactly. So it's probably something similar to that, where you have to use some sort of like diagnostic support or guideline engine that is, because there's just too much research and data to ever properly apply it to your patients. So probably like therapeutic guidelines or some other company that is putting together this data, you have something like Heidi that's collating that and figuring out how to apply it for your patients.
Speaking of autopilot, just because you raised the example there, another negative feature that has been raised is that these kind of AI generated notes, clinicians will be on autopilot and just assume it's right and not really diligently review or assess the clinical validity of them. How would you address kind of those concerns?
I think part of it is in the product, like making sure we have an omnipresent warning, but even that, like there is like modal blindness and other problems where just clinicians, like they, I think it's automation bias, where once it succeeds enough times, you start to forget to check. So for us, it's about building mechanisms to proactively check for accuracy, where Heidi makes mistakes, make sure that we're proactively searching for those things with or without the clinician as much as we can. I think it is just to do with training and engagement of the clinicians, like regularly understanding, like checking your notes, looking for behaviors in the product, like are they editing notes at all? Is the edit rate dropping? Like if it is, engage in proactive, like whether it's notifications or kind of like putting your hands back on the wheels, like, you know, that kind of thing.
And I know these things are repeated throughout by medical indemnity insurers, peak bodies like AHPA and the AMA, reiterating to their users, basically, if you're going to use tools like this, please check the output. That's kind of your number one step.
I do think so. Just last point on that I do think that clinical things are slightly different. Like I can't think of a time where I didn't check my admission notes. Like I do think we hold ourselves to a different standard when it comes to documentation. So what I suspect we'll find is that when someone is using AI, their overall quality of their documentation is way higher, and there's actually less errors than if someone didn't use it. But what people will have to get comfortable with is that sometimes tools like Heidi may introduce errors that a clinician might not have made, in the same way that like a self-driving car will crash less than a human, but when it crashes, maybe it's not in the way that a human would have.
It would do a hard left turn.
So it's going to be this difficult balance of like accepting the limitations, training, engaging, doing everything we can in the product, and then we just accept the result we get because it's overall better and higher quality and more accurate.